A 13-year-old girl is brought to the clinic by her mother due to difficulty walking. The patient noticed a mild ache in both hips 2 months ago that occurred most days after walking home from school. The aches usually resolved after rest, but this week, the aches have worsened to the point where she has difficulty walking and ibuprofen only minimally relieves the symptoms. Her mother attributed the symptoms to muscle soreness related to deconditioning because the patient gained noticeable weight over the past year. The patient has no chronic medical conditions and takes no other medications. Height is at the 75th percentile and weight is at the 97th percentile. Temperature is 37.4 degrees Celsius, 99.3 degrees Fahrenheit. The patient has a waddling gait with both feet turned laterally. Bilateral knees have full range of motion. Both hips externally rotate during hip flexion, and there are no palpable clicks when the hips are brought back to extension. There is limited internal rotation bilaterally and mild tenderness to palpation at the bilateral anterior groin. What is your differential diagnosis? This adolescent girl has chronic aching and limited internal rotation of the hips consistent with flipped capital femoral epiphysis (SCFE). Weakening of the femoral epiphysis, in other words, growth plate causes anterior displacement of the proximal femoral diaphysis with posterior slippage of the femoral head. Both hips are affected in 40% of cases, and many patients with unilateral SCFE will develop slip in the contralateral hip in the future. SCFE most commonly presents in obese adolescents aged 10 to 16 with limp and chronic pain, ache of the hip, thigh, or knee that worsens with activity. Patients with unilateral SCFE may have an antalgic gait to avoid bearing weight on the affected leg, whereas patients with bilateral SCFE often develop a waddling gait, as seen here. Feet are pointed laterally due to limited internal rotation of the affected hip, and external rotation of the thigh during passive hip flexion is a characteristic examination finding. Radiographs are diagnostic and show displacement of the femoral epiphysis, which resembles ice cream slipping off a cone. Management involves stabilization of the epiphysis with surgical screw fixation. Iliopsoas bursitis is inflammation within the bursa posterior to the iliopsoas muscle due to overuse or trauma. Patients have hip pain and limited range of motion, but a palpable click with manipulation of the hip is typically present, which is not seen in this patient. Osteosarcoma is a bony malignancy that most commonly presents in adolescent boys with localized bone pain and swelling, usually at the distal femur. A soft tissue mass is typically present, and bilateral disease is unlikely. Physiologic genovalgumnocmy refers to the developmentally normal leg alignment in children aged 2 to 5. Affected children typically have no symptoms, unlike this adolescent with chronic pain and an abnormal gait. Transient synovitis, which can cause a limp and pain in one or both hips, presents in children aged 3 to 8 and usually follows a mild viral illness. Symptoms typically resolve within weeks. This patient's age and chronic symptoms make SCFE more likely.